All right, let's just jump right into this explainer and unpack the upcoming 2027 financial shock to Medicare Part D and exactly why it's happening. Look, if you follow the healthcare space, you already know there's a massive shift on the horizon. So today, we're going to break down the specific policies, the timelines, and the real-world dollars and cents driving this whole disruption.
The big question we really need to tackle right out of the gate is this. Are your standalone Medicare prescription drug benefits about to get significantly more expensive? Honestly, yes. Whether you're a Part D consumer yourself or a professional navigating the insurance landscape, you really need to brace for an imminent spike in standalone prescription drug costs. We're looking at a fundamental shift in how these plans are funded. And those ripple effects, they're going to hit consumer wallets directly.
So here is our roadmap for today. We'll start with the 2027 Part D shock, trace the IRA's domino effect, look at the temporary shock absorber, discuss pulling the plug early, and wrap up with exactly what it means for you. Let's start with Section 1, the 2027 Part D shock. A major disruption is coming to the market, and it's coming fast. What's really fascinating here is the actual piece of paper that triggered this current wave of market panic. What we're looking at is the official July 28th, 2026 memo from CMS. Now, I know it looks like a dry, bureaucratic document, but in it, the government abruptly announced the conclusion of the Part D premium stabilization demonstration. Basically, in plain English, they announced an immediate end to the federal assistance that had been flowing directly to insurers. And while that CMS memo might sound like standard regulatory jargon, it set off alarm bells. Just listen to this quote from a Spark general agent, which perfectly captures the real-world panic. They said, carriers built their 2027 plans assuming it would stay, so now they need to find a way to close that funding gap fast. These insurance companies were literally in the middle of designing their plans and pricing for the next year when the rug was just entirely pulled out from under them. Which brings us to Section 2, the IRA's domino effect. To understand how this massive funding gap even happened, we have to look back at the very first domino. It's essentially a 5-year chain reaction. Back in 2022, the Inflation Reduction Act, or IRA, was passed. That structural change forced the creation of a special subsidy in 2024. Then, the signature feature of the IRA, that cap on out-of-pocket costs, went live in 2025. And finally, the sudden end of that very same subsidy in 2026. The crucial turning point really boils down to this $2,000 figure. The 2022 Inflation Reduction Act brought in some major consumer-friendly changes to Medicare, absolutely, but the most significant was a hard cap on how much seniors actually have to pay out of pocket for prescription drugs. Starting in 2025, that cap was set at just $2,000 for the entire year. For patients with sky-high medication costs, this was life-changing relief. But here is the catch. The IRA actually created this current crisis through a pretty profound unintended consequence. While that out-of-pocket limit was a massive win for the consumer, a huge financial liability was instantly shifted directly onto the private insurance companies administering Part D plans. Because insurers were suddenly on the hook for so much more of the drug costs above that $2,000 mark, everyone expected them to dramatically hike monthly premiums to compensate. And that leads us to Section 3, the temporary shock absorber. Seeing those huge premium increases coming down the pike, the government realized they had to apply a Band-Aid. So they created the Premium Stabilization Demonstration. Notice, this wasn't a law passed by Congress. It was actually an emergency federal program created administratively by CMS under the Biden administration back in 2024. The whole point of this program was to pump federal dollars right into insurance companies to legally cap how much they could raise premiums year over year. Think of it as a really expensive short-term shock absorber meant to keep monthly premiums artificially low for seniors on standalone Part D plans. But, keeping premiums artificially low does not come cheap. Take a look at this staggering cost. It required an estimated $9.8 billion across 2025 and 2026 to subsidize these private insurers. That is nearly $10 billion of taxpayer money deployed strictly as a short-term intervention to hide the true cost of those new IRA rules from the consumer market. Which brings us to Section 4, pulling the plug early. Because of that immense cost, a major policy shift just happened, where this massive government Band-Aid was abruptly ripped off. Back to that July 28th, 2026 memo from the CMS Office of the Actuary. In it, the Trump administration officially announced they were concluding the premium stabilization demonstration, ordering a complete return to traditional market conditions for the upcoming 2027 calendar year.
Just like that, the federal funding stream was officially shut down.
And what makes this so wildly disruptive is the timeline. The original plan was a 3-year pilot program designed to run gently through 2027 to help transition the market. But the actual reality? The program is terminating on December 31st, 2026. That is a full year earlier than any of the insurance carriers had planned for.
So, why end it a year early? Well, the administration's stated reasons are pretty straightforward. First, they argue that insurance companies have had more than enough time by now to adjust their pricing models to the new IRA realities. Second, ending it early actively prevents billions more in taxpayer money from being funneled directly into private insurance companies. And finally, CMS noted that their analysis of the 2027 bids indicated carriers had enough experience with the redesigned benefits to support a return to a normal, totally unsubsidized market.
All right, Section 5, what it means for you. Let's translate all these bureaucratic memos and funding gaps into exactly how this impacts the Part D consumer's wallet. First, let's start with the good news, okay? The absolutely crucial point you need to remember is that your core prescription drug benefits are not changing. That $2,000 annual out-of-pocket cap on medications is written into federal law and it remains fully intact. The IRA made sure of that. Your protection is safe and it isn't going anywhere. However, and this is a big however, because insurers no longer have the government absorbing the costs of providing that protection, base costs are already rising. For 2027, the Part D base beneficiary premium is set at $41.33. That's a strict 6% statutory increase over the 2026 rate. But keep in mind, this is just the base benchmark. It's not necessarily what you are actually going to pay because individual plan premiums are going to vary wildly based on how carriers scramble to make up for their lost funding.
And this right here is the true financial gap. Industry professionals estimate that those federal subsidies were worth anywhere from $5 to upwards of $50 or more per enrollment, depending on the specific plan. Think about that for a second. Every single month, for every single enrollee, the insurance company is suddenly short up to $50 they were banking on getting from the government. They have to make that up somewhere.
Which leads to a cascading set of impacts for Part D consumers in 2027, because insurance companies will have to set their 2027 prices entirely without this federal help. Millions of seniors on standalone Part D plans are likely going to see their monthly premiums shoot up. But it doesn't stop there. To offset these costs, carriers are widely expected to roll out higher prescription deductibles and higher copays. And if you're on a Medicare Advantage plan that includes drug coverage, we're likely to see aggressive cuts to your extra benefits, things like dental, vision, hearing, and flex cards, just so they can balance the books.
So, here is the bottom line. The era of artificially low premiums acting as a shock absorber is officially over. The full weight of the IRA's redesigned benefits is shifting squarely back onto the open market. And as these new unsubsidized costs ripple through the entire system, taking an active role in your healthcare choices has literally never been more critical. As the dust settles on this 2027 shock, will you be ready to closely review the details and aggressively shop for your best plan?